When you look at the human body, you have to remember that the human body is made up of cells. And cells, they have fluid on the inside, and that fluid is called intracellular fluid. And because they are living cells, they are also surrounded by a fluid, which is called the extracellular fluid. Now, one easy way to think about the fluid inside of the cell and the fluid outside the cell is by looking at what is the fluid made up of. So most of the fluid is basically water, and in the water there are all kind of molecules, electrolytes. And again, to simplify things, one way we look at the fluid inside of the cell is by using sodium chloride as a reference. So we'll say the isotonic fluid inside of the cell is made up of 0.9% sodium chloride. So that means in order for that cell to remain healthy and function normally, that means the fluid on the outside also should be isotonic, which means again 0.9% sodium chloride. So when the concentration of fluid and the concentration of salts inside of the cell, outside of the cell, are both isotonic, that means the cell is not going to gain or lose fluids. However, if we take that cell and put it in, let's say, a pure water, and the pure water sometimes we call it distilled water, which means it's water that have no salts in it. So what happens to the cell if we put it in distilled water? The distilled water is considered to be hypotonic. What that means is it has more water than salt, so the water will move from the outside to the inside of the cell. Again, we're talking about a human cell, so that means the cell will gain water and it will increase in size, and you can think of it, if it's red blood cells, that it's going to rupture and lyse, which means it's going to die. What happens if we do the opposite? If we take that cell and put it in what we call hypertonic solution, which means a solution that will have less water than what's inside of the cell, because it has a lot more salt than what's inside of the cell. So let's say we put the cell in a 10% sodium chloride solution. What's going to happen is that the cell is going to lose water, so it's going to shrink. If it's a red blood cells, it's going to be crenated. Again, the cell is not going to function normally, and most likely the cell will die if it remains in that type of environment. Now you might ask yourself, so why do I need to know about isotonic, hypotonic, and hypertonic? Well, one way you can think of is what you already know, that sometimes patients in clinics or in hospitals, they will give them fluid, and they will put the fluid through the vein. So they basically will make intravenous connection. Now that fluid has to be isotonic, because if it's isotonic, let's say it's in 0.9% sodium chloride, then that means all the blood cells are going to be happy and normal because they've been exposed to isotonic type of environment. However, if you were to put distilled water, which is a hypotonic solution, or 10% sodium chloride, which is a hypertonic solution, then you're going to change the blood cells, and that could lead to the death of the patient. So that's one simple reason why we need to know about the effect of these type of solutions on the cells of the human body, and how the movement of water in and out of the cell can influence the normal function of the cell, and that we want to be sure that cells are maintained in an isotonic type of environment.